Now, anyone with varicose veins knows how debilitating they can be, painful and unsightly, and they get worse with time. But there may be some good news with a non-surgical treatment that can be done during your lunch break.
Ultimately, it's quite a simple, straightforward.
It's just amazing, the difference. It's life-changing.
To avoid having to go into hospital is a huge benefit, and I think that's what most people are looking for.
You may not have heard of this nifty device, but trust me, you'll want to.
I previously wasn't able to fly. I spent most of my time trying to cover my legs so people couldn't see them.
Carol Napleson was living her retirement years in pain from pesky varicose veins. She wanted to see the world, but couldn't because of the higher risk of deep vein thrombosis. So she thought she'd try a little known and reasonably new non-surgical treatment.
It's noticeable the first day of the treatment that the veins have gone somewhere. I have no pain in my legs. I no longer wear compression stockings. I feel like I can wear a dress for the first time in 30 or 40 years.
You must feel like a new woman.
Oh, it's amazing.
It's a condition that affects up to 1 in 3 Aussies, more common in people who work in jobs where you stand a lot, like hairdressing and trades. Those who have it in the family are overweight or pregnant.
We're trying to make the process as simple for the patient, so it's usually a walk in and walk out procedure, but we want them to return to their normal activities and return back to work as soon as they can. We want to keep the pain as low as possible, and so for most cases we're seeing minimal discomfort after the procedure, and most importantly we're seeing fewer complications, and that's what patients are demanding.
Dr Peter Paraskevas is from Vein Health Medical Clinic. Today he's performing radiofrequency ablation, or RFA, a varicose veins treatment that could be done in your lunch break.
We're not cutting into the skin, we're certainly not introducing scalpels and invasive equipment.
It works by using a catheter that's heated up by radiofrequency energy to heat the vein and seal it off.
So this little piece of equipment has really changed things in the industry.
Yeah, it's made everybody think about how better to treat patients. I think it's up the ante in a sense. It's made us improve our techniques, and if it's mainly about patient comfort, but at the same time we want an effective and long-lasting result.
We've come a long way. Once upon a time, the only serious option was something called stripping, where patients would go under general anaesthesia and the knife. Independent vascular surgeon Claire Campbell says patients now have better high-tech options. Her preferred option is minimally invasive laser ablation.
The risk of a deep vein thrombosis or a blood clot after stripping is actually 50 times higher than after laser ablation. But the modern treatments are not only safer, but they're also much cheaper for the government.
73-year-old Carol has had 3 painful, unsuccessful surgeries in hospital before this treatment.
If I'd have known years ago, my legs wouldn't have deteriorated to where they have.
For surgery, there's also a public waiting list time of up to 5 years. Getting laser or RFA in a private clinic does come with a cost, usually a few grand after a small Medicare rebate.
Unfortunately, Medicare and item numbers and rebates just haven't kept pace with the development of modern technology, and hopefully this will change in the near future.